Everyone is talking about how to push baby out. So many people know that there has to be more than just holding your breath for hours on end and almost passing out in order to get your baby out of your body. So what is the secret? I have the secret, and I just wrote a whole entire book on it called Pregnancy Era: The Secret to a Tear-Free Birth and Fast Postpartum Recovery. And in that book, we cover exactly how to breathe your baby out of your body without causing damage to yourself and without holding your breath for hours on end. It is so old school now to teach and instruct people when they're in the hospital to just hold your breath and push with all your might for 10 seconds. And the nurses will count down, and then you're pushing and holding your breath the entire time. When in reality, there is a much better and easier way to get your baby out of your body, but it's just not talked about. And it takes a little bit of preparation. So in this video, I'm going to talk about what that preparation is, what it looks like, and how to actually breathe your baby out of your body. If you like this video, please like and subscribe to our channel. We put out 2 videos every single week in the hopes to help change healthcare for women and change the experiences that we have during our pregnancy so we recover so much faster postpartum. And so these issues that can come from like tearing and from pushing for hours, if we can prevent issues that come from those events, then we will have much better experiences in our bodies, and our health will be so much better for the years to come. Pushing for hours on end can cause things like hemorrhoids, can cause things like anal fissures, and can cause pelvic organ prolapse, which creates like a heaviness and a pain in the vaginal canal. And no one wants that. We want to experience feeling like our birth experiences empowered us, didn't leave us feeling completely wrecked. So I want you to watch this video in its entirety so you can learn how to push your baby out safely and effectively. All right, here we go. The very first thing I need you to understand is that your uterus pushes the baby down through the birth canal and out during the labor process. So when you go into labor, or when you even start feeling Braxton Hicks contractions are like these little mini contractions that start, and they are like practice contractions. You're not in full-on labor when you're having Braxton Hicks contractions, but it's a really good sign because your uterus is literally just warming up and learning how to start contracting. And then as we progress through labor and we start to go into actual active labor, our contractions get a lot more plentiful, they get stronger, and as the uterus contracts, so if you pretend that my hands are the uterus and the uterus is a muscle that contracts, those contractions can be 30 seconds, they can be a minute, they can be a minute and a half, they could be 10 seconds, right? So depending on the intensity and length of the contraction, when that happens, then it typically relaxes. Contraction, relaxes. What happens during that contraction is as the uterus is contracting, the baby is getting pushed down through the birth canal. When that's happening, the baby's head is engaging with the cervix, and that cervix begins to open because of these contractions from the uterus. So how do we use these contractions and simply allow the uterus to push the baby out so we don't have to volitionally hold our breath and just bear down and push for hours on end, right? That's not good for anybody. That will cause bloodshot eyes and a lot of other issues and make for a less enjoyable birth experience, and not to mention can cause more trauma to the actual perineal tissue and to the tissue where the baby comes out. So let's talk about this. Now that you fully understand how the uterus pushes the baby down and out, how can we use our own muscles to help get this baby out? Well, we're going to do a couple things together. We're going to do a breath together, and then we're going to connect that breath to our pelvic floor opening. And then with this movement and with the breathing, you're going to feel that opening in the pelvic floor, or at least you should. And if you don't, then you're going to keep practicing everything we go over in this video, and you're going to do it on repeat every single day up until your delivery. And then when you get to delivery and you are laboring, whether you're doing this at home as a free birth or as a home birth, or whether you're doing this in a hospital with an epidural, it doesn't matter. You can do this type of breathing and during the entire labor, and also to help get the baby down and out, okay? So we're gonna use your diaphragm. Your diaphragm lives underneath the rib cage. when you take a deep breath in, so we take a nice deep breath in and exhale, okay? When we inhale and fill our lungs, the diaphragm descends into our belly. And exhale, the diaphragm comes back up. You get a recoil, okay? So inhale, diaphragm descends. Exhale, diaphragm recoils. That understanding is really important because as you are laboring and you start to experience contractions, you want to use this type of breath to help manage the contractions. A, it will help with the pain tolerance, but B, it's going to also help drive the baby down into the birth canal itself. So you're going to take a nice deep breath into belly. Diaphragm descends. Exhale, you get the recoil. Inhale and exhale. And that is the move. That is called diaphragmatic breathing, but when you're doing it during labor, what is happening is that your diaphragm is descending and it's pushing down on the top of the uterus, which is helping the uterine contraction be more effective in helping bring baby down with that contraction. So essentially your breath, simply just breathing with the driving that breath more abdominally instead of breathing in your chest up here. When you drive that breath more abdominally, it's helping bring the baby down into that birth canal, engaging with the cervix, helping open the cervix more. So it can make your labor more effective. Okay, so now that you have that down, we need to connect that diaphragmatic breath into the pelvic floor opening. So how are we going to do that? All right, glad you asked. So what we're going to do here is I need you to connect down to your pelvic floor. So if you connect down to your pelvic floor, if you squeeze and do whatever you think a Kegel is, let's pretend like you're trying to stop the flow of urine, okay? So you're squeezed like you're trying not to pee or you're trying not to fart. Okay, that is a Kegel. That is a muscle, pelvic muscle contraction. We do not want to be doing that. We want to be able to release that, and then we want to have an extension, so an excursion of that muscle. It's called an eccentric lengthening. Who cares what it's called? We want eccentric lengthening of that muscle so that baby can then just slide through. The uterus can push the baby out as the muscle just opens, okay? So we have to learn how to do that first. We have to learn how to connect to these muscles in order to be able to replicate this during the labor process. So bear with me, join me as we do this. We're gonna take a deep breath into our bellies, and we are imagining our holes, our pelvic floor opening when we inhale. As you exhale, you get some natural recoil. You're not contracting. Do not contract. You do not need to practice Kegels and prep for birth. You need to practice relaxing in the excursion, the bulging. So when we deep breath in, diaphragm descends, pelvic floor opens, all our holes open, elongating, exhale, feel the recoil. If you're like, lady, I cannot feel that. Dr. Allison, how do I practice feeling that? Well, if you're comfortable touching your own body, you can simply just put a finger right outside the vaginal opening and feel that opening with the inhale and see if you can get that connection going. If you're like still not feeling it, you absolutely need to come see us. Come see a pelvic expert physical therapist. We will do a full exam getting you connected to your pelvic floor. And that's absolutely essential to really truly prepare these muscles for birth. But if you don't have access to that, that's okay. Do this breath pattern every single day for 5 minutes a day, connecting down to pelvic floor, and you will start to build that connection. Now you can also do this in a sitting position. So if we are seated, we want our sit bones, these things back here, we want our sit bones on a hard surface, and then you can feel in between the sit bones, you can feel the pelvic floor against a hard surface open when you inhale. So we're going to inhale together. Inhale, feeling the pelvic floor open, and exhale. Inhale, feel the pelvic floor open, and exhale, feel that pelvic floor recoil. So sitting can give you a different proprioceptive response to feel the opening. The biggest important takeaway from this entire video is that you understand with every inhale, you want to drive the air down into your belly and you want to feel the connection of the opening to the pelvic floor. Once you get that down and you start training that every single day for at least 5 minutes a day, then you are going to be more prepared for birth to help breathe baby out. Now, it's also important that you advocate for yourself and that you tell everyone that's going to be a part of your birth process, whether that's your partner or a midwife or a doula or whoever, that this is what you want to do to breathe your baby out. As a matter of fact, just send them the link to this video so they know the type of breath pattern that you want to engage in when you're contracting and when you start the labor process. You just lock in to this breath pattern for the rest of your labor. And then when you start to feel that deep, intense urge to have a bowel movement, it is so intense that you don't think you can hold it in. That is most likely when you are about 10 centimeters dilated. Now, some people prefer that someone checks their cervix to tell them when they're ready to push, and that's great for some people, especially if you're birthing in a hospital system with an epidural. But even if you have an epidural, you will get that intense rectal pressure that makes it feel like you can't hold anything in, and that is your ticket to knowing that you're ready for baby to come through birth canal. You're ready to push. And now, when we go into the pushing aspects of laboring, we have this connection, and we've already been breathing like this. All we have to do is continue to breathe like this. Okay, so we're gonna deep breath in, into belly, opening pelvic floor, exhale, let it go. On a contraction where baby starts to emerge through the birth canal, all we are doing is we're simply elongating and relaxing and overstretching for baby to come through birth canal. We are not volitionally pushing. Now, if your stretch isn't enough for the uterus to work through in order to push baby out, there is some volitional pushing that can happen. And let's talk about what that looks like so you're not breath holding. And when you're not breath holding, you're going to protect your perineal tissue more and have less likelihood for tearing. So when we do that together, what this looks like, and I'm going to make some funny noises so you can kind of play with these noises too and figure out where you get the most opening and excursion of the muscles for baby to come through. So when we push volitionally, we're going to do a nice deep breath at the top of the inhale. Exhale, let it go. Now we're going into the push. Inhale and open. Now I'm going to bear down and start the push like I'm trying to fart, but I'm still breathing. There's no closure of my glottis. What is usually taught in the hospital system is you deep breath in, hold your breath, and you push with all your might for 10 seconds, and really prolonged 10 seconds. And so we want to avoid that. We want to avoid that for many reasons. But when you are breathing baby out, you can use voice sounds to help open pelvic floor and help get baby out of birth canal. What does that look like? Here's what it looks like. We're going to trial a sound, a low-pitched sound. Anytime we use these low tones of our voice, we call them low glottal tones, they open up the vocal folds in the throat, so your throat opens up. And because the throat is on the same line as the pelvic floor opens up. So you want to play with, and you can practice this at home. If I talk in a really deep voice, can I feel my pelvic floor open? And if I talk in a super high-pitched voice, can I feel my pelvic floor elevate? We want to focus on the opening. So if you find before labor what those low voices are that you feel like you can connect to with the pelvic floor opening, those could be your pushing voices. Common pushing voices are moo or grrr. That was a little high, so you got to play with it. I feel a bear down with that, but or and just play with that voice and see where you feel the most opening. And that's what you'll want to utilize. So when we go to push volitionally, we'll deep breath into our bellies. And then at the top of the inhale, we can start the moo. As we bear down and open for uterus to push baby out. So I hope that is helpful for you, and I hope that you can rewatch this video many, many times as you start to train for labor. This is absolutely essential. Now, I will tell you, most people don't have enough range of motion in their pelvic floor to breathe baby out. So you need to practice on getting that range of motion before delivery. How we practice that in clinic is with our body motion birth preparation protocols, where we manually help overstretch these muscles. When we are overstretching these muscles and preparing them for birth, what happens is that they become super freaking strong, and the blood flow to these muscles is so vast that that you get just this whole epic new range of motion. And when you get more range of motion, it actually means you're stronger. So don't think like, oh, I don't want my vagina more open. No, it actually means that it's way more strong because it has more range to work with. So it becomes a way stronger muscle. But then baby can just slide through without causing tearing during the delivery. Now, and even if it does cause some tearing, that tissue is going to heal so much faster because of the fact that it already had all this blood flow. It was used to overstretching, and so the tear becomes a non-issue. When you tear a muscle that's not used to stretching at all, and all of a sudden you tear it and it's stitched up, that scar tissue is going to be so dense and that muscle is going to become so weak and tight that that makes a longer recovery, a harder recovery. So when you can get range of motion, and this is why doing pelvic floor work before birth is so epically important, because you can work on getting that range of motion. It really takes manual internal work to change the range of these muscles. And if you don't have access to that, just at least start doing the breathing, and that will give you at least a start to opening up these muscles. You can also come to Body Motion Physical Therapy in Edmonds or Poulsbo, Washington. We have people that travel from all over the world that come here for what we call intensive. So they'll come for 3 to 4 days just to get some internal work done before their pregnancy. We'll have people that come during their second trimester and their third trimester. We don't do the internal part during the first trimester unless there is severe pain and the provider is hoping that we'll do internal work during that first trimester. But as long as it's just a birth prep situation and someone's flying in from out of state, that's how we operate. We do these things called intensive treatments, and people leave feeling epically amazing, no low back pain, no pubic symphysis pain, and just feel really good for the rest of their pregnancy. So I hope you found this video valuable. Please leave me a comment. Ask me all the questions in the world. I hope you have the birth of your dreams. I hope that this video can help support you on that journey. And please go purchase the book, Pregnancy Era, The Secret to a Tear-Free Birth and Fast Postpartum Recovery. It has a ton of solutions to keep you feeling pain-free during your pregnancy. And absolutely all the birth prep that you're going to need is there in that book to help you have a fast pushing experience and decrease your risk of tearing. So go check it out. It's on Amazon. We'll link the link in the comments, and leave me your comments with whatever questions you have and I will respond to them directly. I'm Dr. Allison Felt. Thanks for joining me today.